resisted issuing a stay-at-home order, though, preferring instead to let the state health department and individual communities call the shots.
Denver 7's Sloan Dickey begins tonight's 360 conversation with more on that approach. And Sloan, I know you've spoken with doctors and other experts today. Do they believe current restrictions in communities like Denver and Adams County are enough to curb the spread?
Well, in short, it's complicated. Yes, they said that stay-at-home orders and guidelines are helpful in slowing the spread, but it's all for nothing if people don't follow those guidelines. They say that COVID fatigue is real, and the next challenge is keeping people motivated to slow the spread.
We need a little bit more discipline here. I know that we can do this, Colorado.
As coronavirus cases spike across the state and nationwide, Governor Polis is once again encouraging action from Coloradans.
Avoid interacting with people outside of your household, wear a mask around others. We just need to have the resolve and the discipline to reduce your exposure risk and the exposure risk of loved ones.
With many counties across Colorado moving back to safer at home measures, the question becomes, is the governor's repeated messaging really getting through?
So our hospitals are getting full and the beds are getting scarce right now. So we are very concerned.
Dr. Ahmad Rashid is a pulmonologist at National Jewish Hospital in Denver. He'll be the first to admit there are a lot of chips stacked against us.
Pandemic fatigue is real. People are just tired. And they also, we had pretty good months in August, September, and start of October. So people, I think, started to get their guards down a little bit.
Over the weekend, 84% of the state's ICU beds were occupied after Colorado has seen thousands of new COVID cases every day for a week.
I worked all weekend, this past weekend, and the volume was quite noticeable as far as the numbers of patients, the COVID patients we were seeing, both coming in by EMS and just from walking in from the outside community.
Dr. Eric Hill works in the emergency room at Aurora Medical Center. He sees the evolving pandemic through the lens of a frontline worker. He also understands why the state can never mandate us out of a crisis.
Personal responsibility is everything in curbing this disease. I mean, you can make a mandate all you want, but if people don't believe it, if they don't believe it's in their best interest, if they don't see the personal consequences to themselves, we have a problem.
Governor Polis is sticking by his belief that individual counties must react to their own COVID conditions. Denver just mandated a curfew that started this weekend.
It's not about enforcement other than it's about the Grim Reaper is the ultimate enforcer. More Coloradans will die if Coloradans don't simply cancel their social plans and wear masks in public.
Both doctors agree enforcement is useless if people won't pay attention, and peaks and valleys will be part of the evolution.
There will be a peak. It is up to us, as a community to determine how high or how dangerous that peak is in terms of utilization of healthcare resources.
We're going to have some pain and inconvenience over the next month, but if we don't get on top of this, we could be in the several 100,000 cases across the country, by a month from now.
The numbers are a bit frightening, but with a potential vaccine on the horizon and new therapies to help those infected, the best message may be hope.
I know that we can do it. We did it before. We can do it again. Everybody's tired of it, but I'm hopeful that the vaccine and the light at the end of the tunnel will inspire us in the final few months to do better.
Now, Governor Polis also mentioned in that press conference he understands this is a struggle for most Coloradans, but he also understands that Coloradans know how to keep people safe. On Capitol Hill, Sloan Dickey, Denver 7.